Hello, and welcome to our webcast. I'm Amy Pendergrass with Moss Adams, and I'm going to get us started for today's session, Overcoming Organizational Crisis at Laguna Honda Hospital. And we're pleased that you've joined us today. And now I'm going to play our housekeeping video.
Welcome, and thanks for joining. We're pleased to present our continuing professional education webcast series. Before we begin, please keep the following in mind. You can customize how you view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can adjust window size and placement or enter full screen mode using the controls at the top right of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons that relate to a different aspect of our session. You can download a PDF of today's slides from the Slide Deck and Handouts widget. You can ask questions by typing in the Q&A window and clicking Submit. We'll do our best to answer all questions or follow up via email. If you experience technical difficulty, refresh your browser by hitting the F5 key. Today's session offers 1.5 CPE credits. To receive credit, you must meet the National Association of State Boards of Accountancy requirements. You must attend at least 75 minutes of the session and respond to at least 75% of polling questions. To participate in the polls, please check the button next to your answer within the slide window and click Submit. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget and download your CPE certificate. Don't worry if you can't download your CPE certificate today. We'll email you a copy in 2 weeks. If attending this webcast in a group, you must complete our group CPE attendance sheet, available in our Slide Deck and Handouts widget to receive credit. Please have all group members sign it and send only one sheet per group. CPE credit can only be awarded to participants registered as themselves and isn't available for participants who view the on-demand version. This presentation is not legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
All right, and with that, I'm going to turn it over to today's presenters to get us started. Thank you.
Thank you so much, Amy. Well, welcome everyone, and thank you so much for joining the webcast today, focused on strategies for overcoming organizational crisis and the story of Laguna Honda Hospital. My name is Ryan Joyner, Consulting Director here at Moss Adams, and I'm joined by my fellow Consulting Director, Malie Maysilles, to help tell the story of the unparalleled and Herculean effort to recertify Laguna Honda Hospital and ensure that the San Francisco Department of Public Health can continue to serve its most vulnerable residents. We're grateful to have two executive leaders here from the San Francisco Health Network, Troy Williams and Baljeet Sangha, who are heroic in their efforts leading the recertification journey. Before getting started, though, we have our first of 6 polling questions to set the stage for today's discussion. Starting off with a softball here, you can go ahead and start answering, but the question here is your organization currently experiencing significant organizational challenges? Although we hope to see mostly no's here, we do know, at least within healthcare, there's continued margin pressures and issues with staff turnover that a lot of organizations are experiencing. On top of that, too, there's always regulatory compliance and the ongoing challenges of operating healthcare organizations in today's environment. All right, we're looking at about 60%, 65 now of attendees that have answered. So we'll give you a few more seconds to go ahead and get those answers in. All right, looks like we have a pretty even split here between organizations not experiencing organizational crisis and those that are. Not sure I expected those results, but thank you for completing that first poll, and good luck out there with those experiencing crisis. So with that first polling question out of the way, before handing the floor to Troy and Baljeet to introduce themselves and tell us more about the history of Laguna Honda and its decertification from Medicaid and Medicare in April of 2022, our entire Moss Adams team wants to thank our many collaborators, including Health Services Advisory Group, Elite, and Health Management Associates. and most importantly, all the leaders and Laguna Honda staff that we had the honor to support, and other health network leaders such as Roland Pickens and Terry D'Antoni. The leaders and staff at Laguna Honda demonstrated remarkable fortitude and persevered through myriad challenges in the face of unprecedented organizational adversity, which you'll learn much more about today. And they did so by always prioritizing the well-being and needs of their residents. Thank you for the opportunity to support you in your incredible journey. So after spoiling the happy ending of recertification, this would obviously be a very different webcast if that wasn't the case. I'm going to hand the floor over to Troy and Baljeet to introduce themselves and tell us more about Laguna Honda and the profound crisis that it faced. Troy?
Thank you, Ryan. Good morning, everybody. My name is Troy Williams, and I'm the Chief Nursing Officer and Chief Quality Officer for the San Francisco Health Network, and have had the opportunity to serve as the co-incident commander for Laguna Honda's recertification efforts with my colleague Baljeet. And I'll turn it over to Baljeet.
Thanks, Troy. Good morning or good afternoon, everyone, wherever you are based. My name is Baljeet Sangha. I am the Chief Operating Officer for the San Francisco Health Network. And as Troy mentioned, he and I were partners as co-incident commanders to lead Laguna Honda through our recertification efforts. So with that, would love to advance the slide and first set the context a little bit around, who and what Laguna Honda is and what this organization has meant to not just San Francisco, but to the entire region. So with that, if you can advance to the next slide. Now, a little bit about Laguna Honda. Laguna Honda is the largest publicly funded long-term care facility in the country. First opened in 1867 when one of our presidents that we see on our currency, Abraham Lincoln, was president. So a long history in San Francisco with a number of highly engaged stakeholders and champions who have really coalesced and come to Laguna Honda's advocacy over the last couple of years with our decertification. Skilled nursing facility is a key part of our healthcare safety net, right? The safety net health system, by definition, is that safety net in the communities to catch those who have nowhere else to go. And so we have continued to work to be not just a provider of last resort, but a provider of first choice. But this also means that individuals who are uninsured, indigent, currently experiencing homelessness or underinsured, this is where they come to us for their care. And so the old hospital is based on open TB wards, but we moved into a new building in 2010. And that's what you see here in terms of the timeline. Laguna Honda Hospital itself is part of the integrated delivery system of this known as the San Francisco Health Network. There are 780 beds total. There are 11 acute beds, and because of those 11 acute beds, the 769 skilled nursing facility beds are considered distinct part SNFs. Physically, we have 13 nursing units with about 780 nursing staff and about over 1,200 staff total in the 29 different departments that we have in the organization. So the major takeaways here is more than 150 years, Laguna Honda has been a pillar of San Francisco's healthcare system, caring for those most in need and providing critical healthcare services. And many residents have complicated chronic medical needs along with their behavioral health components, right? So diagnosed mental illnesses and or substance use disorders or any other social or behavioral issues. So with that size of an organization, and we can go to the next slide here. So when an organization of that caliber then ends up getting decertified, it has significant reverberations throughout not just the city and county, but also the industry itself and then also all across the state. I don't believe we're going to be able to hit play on this video, but I believe the link will be made accessible to those attending. And what this video we wanted to highlight was just that over the course of starting April 2022, Laguna Honda, we found ourselves in a major crisis. After a series of survey and citations and revisits from CMS and CDPH regulators, Laguna Honda was formally decertified for failing to meet the Medicare and Medicaid conditions of participation, which means we were not up to par where we need to be to provide the care that our residents and our community is worthy of getting, and that was their right to receive. Which even saying that out loud is difficult and was difficult to get the words out, right? No one wants to say like we failed, but we had to really address that head on. This represented major setback for the city and the Department of Public Health, the hospital, and then also almost 700 residents at the time who were in jeopardy of losing their home, individuals that are living here. So I share that because the video does provide a background on kind of what led to the decertification, but there were key points as it related to Laguna Honda. The federal regulators were going to cut off funding as part of decertification, which would have then, funding itself would have then led to the closure of the facility, right? So that's one thing we were trying to navigate with our, which you'll hear about in the presentation today. As we were moving forward, the funding being cut just meant that our lifeblood for the organization would be cut as well. Decertification also mandated by CMS the transfer of residents out of Laguna Honda to other skilled nursing facilities. And so these were involuntary transfers. Our residents did not want to leave their home. And unfortunately, after their transfers, over the series of several weeks and months later, eventually 9 of our Laguna Honda residents had subsequently passed away to the facilities that they were transferred into. That, was very crushing. And in the video, you'll see our mayor of San Francisco also state that this was truly a matter of life or death. So so what I'm hoping to convey here is really the significance of what was occurring and what was happening to the community. Next slide, please. Now, what you're hearing probably likely in my voice, it's really impossible to understate how terrible and devastating that loss of Laguna Honda would have been to San Francisco and to our safety net. Laguna Honda itself accounts for more than 1/3 of our skilled nursing beds in all of San Francisco. And it's nearly entirely funded by Medi-Cal and Medicare reimbursement. So our payer mix is predominantly that. But even more important than that, the decertification, the closure of the facility would have meant those 700 residents, majority of whom are significantly socioeconomically disadvantaged, would lose their home. And so it's these residents that the city and the Department of Public Health rallied behind in its efforts to recertify Laguna Honda and prevent its closure. And one thing I say is the health network itself, the San Francisco Health Network, sits within the umbrella of the Department of Public Health. So it's really all layers of city government where we're coming together to see what we can do to improve this. Next slide, please. Now, this is where then we knew that we needed to do something. And so recertification was anything but guaranteed, and it required a tremendous amount of improvement that then needed to be done immediately and then also sustained in a very short amount of time. Anyone who has done performance improvement, anyone who does quality improvement knows that, that these steps and these processes take years, right? You roll things out in a methodical way. You want to get, you PDSA it, you hear back from your stakeholders, you update, you improve, and then, you look up 5 years later and there's culture change. Here we were thinking we need to get this done in the next several months. And so with the regulatory experts already assisting with the recertification effort, we knew we need additional support in driving the amount of organizational change management and improvement required. So this brought us to Moss Adams, who we've been trusted partners with in the Department of Public Health for over 10 years. And so we were really lucky that Moss Adams and their predecessor organization for this division had responded to multiple RFPs through our competitive bid process over the course of a decade plus, and continue to demonstrate through that RFP process the qualifications, their ability to deliver products and support in intense, high intensity, really stressful situations. And so previously with that help, it helped us with other accelerated strategy implementations, including the swift setup and deployment of the citywide, so the city and county of San Francisco's COVID vaccination sites, and the rapid deployment of sweeping, transformational changes in our behavioral health services. And so we knew that there was a precedence there, and we were calling upon once more to our Moss Adams colleagues to help provide that level of support to this. Their capabilities with change management and that accelerated improvement were so critical and vital to this successful effort of meeting the requirements of the settlement agreement. And I say settlement agreement is because the city, with our city attorney's office taking the lead, sued the Department of Justice and Health and Human Services to prevent the closure of Laguna Honda. And that legal effort resulted in a settlement agreement where there was an agreement between both sides really what we need to do. What is the path forward? And so I share that because that settlement agreement was really ended up being our roadmap for what we needed to do. And in order to execute on that settlement agreement and our commitments to keep Laguna Honda from closing, we really look to Moss Adams. So that's at this point, I think I'll pause at this juncture and hand it back to Ryan. I think we're at that time for another polling question.
That we are. Well, thank you so much, Baljeet, for the background and for your continued trust in our team, the opportunity to support you all. All right, so this is our second polling question. What is the most significant challenge your organization is currently facing? A, non-business is great. B, regulatory compliance. C, execution of strategic initiatives. D, unreliable processes. Or E, staff satisfaction. I see a number of folks are already answering, which is great, but also want to use this time as a reminder that if you do have questions for any of us presenters, you can go ahead and put them in the Q&A chat, and we hope to have time after the presentation to answer those. All right, we're at about 75% of the audience who have answered. Okay, so taking a look at these, non-business is great for about a fifth of you all, which is great to hear. Regulatory compliance stands out. Execution of strategic initiatives seems to be the winner here. Maybe not surprised to see that. Unreliable operations not being much of an issue, at least in this poll, and staff satisfaction being another significant one here at 23%. All right, well, thank you all for completing that poll. And thank you again, Baljeet and Troy, for the introduction on Laguna Honda and the decertification crisis. And obviously, I know both of you are clearly familiar with our approach to accelerating strategy and managing organizational change. But I think it's worthwhile to share that approach for those less familiar and also describe how we had to modify that approach to meet the clearly urgent needs of Laguna Honda. Now, this is very much a high-level overview, but generally our standard approach to strategy acceleration and organizational change management is to start with the long view to establish a vision or true north of the organization and define the strategic tactics to get there. We then prioritize and sequence those tactics to ensure the organization is executing on the right work at the right time and in the right amount. This is critical for organizational change management as overwhelming teams of change results in only diminishing returns. So by avoiding that, then you actually do accelerate your strategy by focusing on the right work every day. After that, we deploy and cascade the strategy to all levels of the organization by breaking down the tactics into metrics, targets, and action plans relevant for each area, which then establishes linked and aligned goal setting and problem solving from the front line of the C-suite, which can then be used to establish tiered visibility and status reporting into the progress being made across the objectives. Overall, this system engages all staff every day in the execution of the organization strategy and ensures that the front line, where strategy is won or lost, has what they need to be successful. But that's our standard approach, and Laguna Honda was anything but standard. Although we obviously had a clear vision and target of recertification and strategies to achieve it, we knew early on that we needed something different from our standard approach. How do we know? Well, in order to better understand the current state of Laguna Honda and what it would take to reach substantial regulatory compliance, a facility-wide mock survey was commissioned in July of 2022, shortly after decertification, resulted in 101 citations or tags for regulatory deficiencies, which really, for those who've been to surveys, you might gasp at that number, but really kind of set the stage for how much change was needed. What's important to understand, too, is that in Laguna Honda's context at that time, any such deficiency could jeopardize recertification, meeting all required full resolution. Everything, therefore, became an immediate priority, throwing out our key step of true prioritization and sequencing. And really, in fact, at the time of the mock survey, there was no true path of recertification. The settlement agreement had not yet been reached, so we knew we needed an organization transformation in as little as a few months. Even with the settlement agreement in place, though, and the pausing of the closure plan, meaning that residents were no longer being transferred out, it really did not reduce the urgency or the scale of the change required. I think really what drives us home is what Troy said many times, is that we would never choose to do process improvement in this way, but we had to. Troy, any more you would add on that?
Yeah, no, I think that, throughout the whole process, as Baljeet had mentioned earlier, when you're looking at system level improvement, as we all know, systems, often take months to years to change, and we just didn't have that. With the settlement agreement, there were still very tight timelines of when we needed to be in compliance, and there were so many, really fundamental gaps in our regulatory compliance that we really had to do rapid improvement. And so again, I think it was also a kind of a balance of ensuring that we were doing rapid improvement, making the changes that we needed to make, but then how are we going to sustain those in the long term? And so I think it was, as Ryan said, not how we would normally do improvement, but with the timelines and the urgency of what was going on here at Laguna Honda. This is just how we had to respond.
Thank you, Troy. And coming in, we knew we also had to address the deep-rooted challenges that likely contributed to the decertification in the first place. And really, as Troy pointed out, to make sure we're actually not just improving for the short term, but for the long term, and able to sustain that beyond recertification. So some of the observations we had early on were around leadership, including a lack of prioritization and focus, unclear ownership of initiatives, duplicated efforts and missed deadlines. In operations, there were unreliable processes that were often erratic, a lack of role clarity, poor signaling between teams, and really minimal actionable data to really drive improvement of what you're trying to achieve. Culturally, there was little to no accountability, and a lack of SNF resident center practices, largely due to kind of operating Laguna Honda as more of an acute facility rather than a true SNF at that time, and then rigid silos between departments. So with that, and seeing and observing these deep-rooted challenges, we really knew that one of our most important tasks was going to be to implement the visibility reporting systems that I described previously that really drive ownership and accountability for the work, while also working to break down the departmental silos and improve operational reliability. Of course, that's easier said than done when you're trying to lay the foundation for organizational change management on an ever-changing operational landscape. If the task of recertification wasn't imposing enough already, we and the leaders and staff of Laguna Honda and the DPH had to work through turnover of multiple executive and leadership positions, interim and activated leaders in many different roles, an assortment of consultants providing regulatory expertise and advice, which required significant coordination, and also included those assigned directly by regulators, multiple regulatory surveys adding additional priorities each time, and several COVID surges in a facility of high-risk residents. Now, it might sound understated from my somewhat monotonic voice, and I do apologize for that, but truly it is impossible to overstate the level of organizational commitment that was required to navigate all these challenges, especially in the early going after decertification. Baljeet, Troy, I know both you all had to also had to navigate other challenges. So anything else you would add from this perspective of really what all we were facing?
I would add a couple things, and then also just turn it over to Baljeet for his perspective as well. But I think one thing I would add, and I think it gets to Rose's question around recruiting additional staff and resources. Now, being in as co-incident commanders, and Roland Pickens is our CEO, the executive sponsor of the recertification efforts, we were in a HIC structure, Hospital Incident Command structure. And so this was and is the #1 priority for the Department of Public Health. And so as such, we were able to utilize the power of DPH and being an integrated health network to deploy staff here. And so in terms of resources, very similar to COVID, when we were deploying folks to do testing and contact investigation and all of the things that went into that. It's a very similar approach to Laguna Honda's recertification efforts, where we were able to deploy staff from their regular jobs throughout the department and the network to assist us with Laguna Honda. So I think that was a really important piece as well. I think being a public facility, a public hospital, and really the importance of Laguna Honda in San Francisco, really the fabric of healthcare, in San Francisco. Laguna Honda, there was just a lot of stakeholders, both political, the mayor's office, the board of supervisors, our own governing body, health commission. We would provide, very frequent updates to those bodies because they were very interested in, gosh, what are we doing? How are we going to, turn this ship around and get recertified? And so there was a lot of, reporting up and letting folks know who really didn't have a lot of knowledge in SNF regulations, or, this was a very unique situation to folks outside of Laguna Honda. And so I think that was another, challenge for us, but also an opportunity in terms of, really explaining why Laguna Honda is so important to the city, and, and also getting their support, as this was the priority for DPH and San Francisco in terms of the things that we needed. I'll see if Baljeet, anything you want to add there?
Yeah, I nailed it. I think that's exactly it. The challenges of the balancing the multiple stakeholders who everyone feels that they need to know 10 minutes ago before anything hit the airwaves, or also just making sure they weren't receiving information that was already out of date. And so I think that was one of the major challenges, right? Balancing communication, because the better we can balance the communication, the better we can try to temper any visceral, passionate panic or anxieties that would only then, amplify all the staff burnout that, it's already been referenced in some of the questions, is that would, that cycle. So how do you break that doom cycle, that doom loop of anxiety, tension, and because that doesn't help the work ahead of us. And I think that's the key part. The one last thing I'd offer before we continue on is everyone wanted to help, right? Everyone really wanted to bring something to the table. CMS also wanted a successful outcome. CDPH wanted a successful outcome. All of our multiple partners, Moss Adams, Health Services Advisory Group, wanted a successful outcome. But there are also then in situations of, hey, we have some resources for you. We're going to send someone over to your site tomorrow morning. Here you go. And so what ended up becoming is we have a team of multiple individuals separate who want to help. So then how do you coordinate, that choreography, that symphony of making sure everything worked together to achieve the greater aim? So when you have a resource from CDPH who's only used to working directly through CDPH or CMS, our own colleagues from Moss Adams, from Health Services Advisory Group, from Health Management Associates, and our internal teams, you got to make that all work together. I think that was probably one of the other challenges, which is where Moss Adams really also helped step in to help quarterback some of the communication. So I'll stop there, but I think this is a good time. It was just a good time to highlight that component of also what was churning in our ecosystem.
Excellent. Thank you so much for providing that additional perspective. I know we all had many long days and long nights, but that for you two and others, those long days, long nights often extended well beyond what anyone would call long, having to deal with those issues as well. Okay, so with that kind of setting the context of really what we were looking at and really the urgency of how much we had to do, but then with shifting priorities and new issues that arise seemingly every day, the question is, how did we do it? How did we actually change our standard approach to supporting Laguna Honda in this very unique situation? Well, that's going to have to wait until our next polling question is completed. So this is our third one here. So what is your organization's framework for change management? A, none, we tend to wing it. B, managed at the project level. C, we use an organizational change management framework. Or D, changes with every planning cycle. All right, so we'll give you some time to get your answers in. And again, just another reminder that please use the Q&A in the chat to submit any questions that you do have. We'll continue to try to address them, not only as we're going, but hopefully with time at the end as well. Looks like we're at about 65% of folks who have answered this question. All right, getting up to 75%. right, so taking a look at these answers here, none, we tend to wing it at about 18% here. I'm not surprised to see that. I see that often. Managed at the project level, I think, is more common. Very impressed to see the organizational change management framework being at as high as it is, about a third of respondents. Really great. I know the work that goes into that, and that's not easy. And then changes with every planning cycle, I'm not as surprised to see as well. Okay, so with that, and thanks again for completing polling question number 3, ensuring you're getting your CPE. That means we're about at the halfway mark. And I think the main takeaway from that polling question is seems to be a lot of variation in the way organizations manage change management. But back to our story. So what did we end up doing to modify our standard approach to meet the urgent broad needs of Laguna Honda? In many respects, we simply became part of the team by embedding ourselves with the leaders and staff of Laguna Honda to drive rapid performance improvement based on our strategy acceleration framework. This way, we can not only directly implement, teach the tools, framework, and methods, but also, and this, I think this is getting to some of the questions around staff burnout, staff turnover, and things of that nature. But by being there and being the direct partners, we are able to maintain organizational focus amidst turmoil and the shifting priorities in that very complex landscape that we described previously. Also providing continuity through staff and leadership turnover to make sure we could continue marching in the same direction, quickly bring up new leaders, new staff up to speed on what we are doing in the ongoing efforts, and really just continue to drive that performance improvement. And with that too was really creating the capacity for and driving more change by supporting operational improvements and problem solving, making the work easier to do so that you can continue to improve those efforts and take on more of the challenges that we were facing. So kind of overall, the takeaway here is that, despite the urgency and the modifications to our standard approach that we needed, we were actually able to rely on a lot of it and do so in a much quicker implementation, despite Laguna Honda's need to quite literally do everything everywhere all at once. All right, so with that, I'm going to hand the floor over to my partner, Malie, who's going to walk you through some of the examples of our approach applied directly to the recertification at Laguna Honda. Malie?
Thanks, Ryan. And good morning or good afternoon, everyone. So yes, I'm going to walk through some specific examples of what it took to build the visibility and reporting structures that Ryan mentioned, to have the infrastructure to manage the amount of change that needed to be managed. So I'm going to be sharing that story, but before we do that, we've got our next polling question. So this is polling question number 4, which is, what methods have you utilized to overcome organizational challenges in the past? A, nothing special, just get through it. B, transitioned leadership. C, hired industry experts. D, empowered the front line. Or E, implemented new reporting structures. So I'll give folks a couple minutes to answer that question. Again, a reminder, this is number 4 of 6 polling questions. Need to answer 75% of the questions for CPE credit. And please continue to add your questions in the Q&A section. We will be getting to those either during the course of the presentation or after. All right, we're at about 74%, 78% response. All right, great. Okay, so in terms of methods you've utilized, nothing special, just get through it, about 16%, which is great. I think, as Ryan mentioned before, in terms of change management, we do see organizations struggling with having specific methods, but so it's nice to see that most of the folks out there have an approach. Some transitioning leadership, hiring experts. So it's pretty even split actually across the board in terms of how folks have approached that. So that is interesting. Sometimes it does take a combination of methods to be able to manage and address particularly the more complex challenges that organizations tend to face in our industry. So for Laguna Honda, as Ryan mentioned, we knew that we needed to quickly build structures that in terms of visibility and reporting to drive ownership and accountability. And we needed to start with the leadership at the top. So first, we established finding or tag-based initiative reporting. What you see on the left in this slide is a portion of the visibility board used to manage that resolution process. So you see in the left-hand column, the Post-its down the left-hand column of each of those flip charts, each of those Post-its represents a finding. And a finding itself can be a fairly complex issue that a leader might need to resolve. So it has a finding, but with this visibility board, we established an owner for each finding, a specific next step that needed to be completed, and by when that step needed to be completed. So this effectively created a snapshot for each day of the progress that the team was making towards resolving those findings. This snapshot was used to drive the daily discipline of reporting. Each owner reported on the status of each of their findings, including any barriers and any help needed to support needed to meet the target. So Ryan mentioned part of what our team was able to do was become embedded with the leadership. And this is an example where being embedded with the leadership was critical. Because what this allowed us to do was to model the facilitation of the huddles and the use of these tools. And it allowed us to mobilize a large and diverse team of leaders to meet the large volume of challenges that they faced. But not only that, it allowed us to, by modeling, to teach the leaders how to use these tools to quickly and effectively align, and with the intention of eventually the leaders being able to take on the use of the tools. What we also created visibility into is not just a snapshot in time, but also the trend over time. How are we progressing towards targets, both in terms of number of findings resolved, which you see on the top graph there on the right, and then also in terms of a decreasing an overall aggregate risk score that was calculated to measure what is the risk of severe findings being identified in a subsequent survey. How are we doing resolving those critical elements of the findings? So this, what you see here, the visibility partnered with the reporting process, was the first step to create linked and aligned goal setting and problem solving, which would eventually span from the front line all the way to the C-suite. This had the effect of ensuring all leadership were aligned, and it brought duplicate efforts to light so we could consolidate and eliminate those duplications. And it ensured that executives knew each day where additional support was needed and where to focus their efforts and prioritize their efforts each day. Before I move on to the next piece of the system, Troy and Baljeet, how would you describe your experience and the team's experience as we put this first piece of the system in place?
Well, from my perspective, this was critical because what it provided was an improvement structure for leadership and for frontline staff to where you can actually see the work that was being done. And I think that was, had been a challenge for Laguna Honda, historically. And so what this really did was it really, engaged leaders and staff in use of data, really being data driven to improve. It created accountability. So, there were specific people that were accountable to, certain findings and there were report outs. So we knew where we were, at any given moment. And I just think, this it really started to create this culture of continuous improvement. And I think that had historically been a gap. And so this framework that we put forth, we wouldn't be where we are today without this. We needed to engage our leaders, our frontline staff in improvement, and this was a really important step to do that.
Thanks, Troy.
I would offer an additional component there, and Troy nailed it again. No surprise there. The fact that this is I want to tie back to some of the questions that have been asked around just staff morale, staff burnout, and one of the things is if you're trying to dump water out of a sinking ship and you just keep on going at the same path over and over again, but you don't know if you're making any progress, that's a morale killer, right? That's of the many things that can kill morale, culture, and your soul when you're working on such critical and important things where lives are at stake. Progress like this, visible progress, when you start to then actually turn the tide a bit, you start to see more green, you start to see some things advance. That was really helping win back the morale, grow back the morale, because it was justification and validation. If we can keep doing this, if you all can keep doing this, we will get out of this situation and we will be recertified and we will be successful because you are getting us there based on this incremental progress. I think that is probably the key component. And it's the convergence of not just frontline staff seeing it, but the same metrics that then we're showing to those, the plethora of stakeholders we described earlier, up to the mayor herself and the mayor's office, through our director of health, to our leaders. And we know that, CMS, CDPH are also getting this information as well. Everyone's able to see we're starting to see more green. So the optimism grows, the confidence grows, the rhetoric changes. It's more supportive, and it continues to then be, instead of the doom loop I described earlier, it starts to become more of a spiral up and positive. It just kind of feeds off each other. So that's the only thing I'd add because of the importance of a visibility board in so many ways.
Awesome. Thanks to you both so much for those insights. So just moving on to kind of the next level of the system. Next, after starting at the executive level, the next step was to implement similar tools and structures for each executive and their direct reports. So the greatest need here was to break down the high-level findings into metrics, targets, and action plans for each area. So for example, on this board, how do the findings that the chief medical officer is responsible to resolve translate to each of her leaders? What targets do they need to reach by when? What is their action plan to reach those targets? Where are they on track? Where are they off track? And what do they need to focus on each day? So that's what this level of visibility board is intended to convey. And also drove a daily discipline of a daily huddle. For this huddle to be effective, we needed to model and help coach the leaders to open the way for a culture of transparency. So really that meant reporting plan against actual, really being open about sharing barriers and engaging in team-based problem solving, often problem solving that needed across disciplines, and prioritizing support for those areas that were off track. So really moving from a culture that sometimes does not want to share when things are not on track to it being really critical that comes to the surface so it can be quickly addressed was a big part of the culture change here. So this showed where they needed to focus their efforts each day, and it created a clear escalation pathway. So at the executive level, they became more aware of the challenges their teams were experiencing, and then also how to deploy those challenges, meaning which could be addressed within the department, which required partnership with other disciplines, and which might require the support of the full executive team and the incident commanders. So from here, the next link in the chain was to establish a clear way for the directors to partner with their managers, and then managers with their charge nurses. And I'm speaking here specifically around the nursing structure, partly because that was the part of the organization I was mostly supporting, and also partly because they constitutes the largest percentage of the organization staff-wise. So tools in other departments, but you'll hear me refer to nursing quite a bit. So we needed to establish a clear way for these folks to ensure focus on the right work each day. So this was accomplished. What you see here in this slide is setting up a structured daily check-in supported by a status report. And the focus of the status report was to create a proactive plan for how to prevent issues that had been kind of plaguing some of the different nursing units. So if one nursing unit was struggling with managing special diet orders, and another unit was struggling with appropriate equipment storage, each status report could be customized to reflect that. So the units could focus on their most frequently occurring issues each day. What this did then is drove specific actions by the managers and the charge nurses in terms of what they would look for in their rounding and what to highlight in the frontline team huddles, which we'll get to next. And it also had the effect, it started to move the culture from being more in a reactive stance to problems to starting to look at things a little bit more proactively to address their challenges. All right, so the final link was to establish huddles at the front line. Again, this was put in place in many departments, but was probably more critical in nursing in terms of maintaining a home-like environment, providing the highest quality of care, and ensuring that all residents, all families, all staff had a voice and were treated with respect. So here, and throughout this whole system, we partnered directly with Laguna Honda's internal process improvement team to implement the system. But here is really where we and the internal team focused the majority of resources because it was so critical to creating reliable and sustainable processes. So the main focus here was working side by side, elbow to elbow with the frontline leaders and their teams to coach them in the use of data to drive problem solving and to drive experimentation and to drive structured performance improvement. And just for the group's understanding, most of the managers and teams when we got started weren't really used to seeing and using data in this way. So it was really a cultural game changer. Troy and Baljeet both mentioned the importance of the use of data to drive problem solving, but getting the data down to the individual units so people could see what specific drivers were happening on their own unit that were contributing to the overall challenges around the key performance indicators and around the deficiencies that were seen at the highest level was really important. So having this huddle and coaching the leaders in facilitating the huddle day by day really helped them get a deeper understanding of their data. It helped them get visibility into those drivers of the findings, what specifically was happening most commonly on their unit that they could focus on. And maybe even more importantly, it gave them a forum to empower the teams to be problem solvers in addressing those drivers. So I want to pause here again, Troy and Baljeet. I think this piece in particular was such a key component. What's your perspective on the impact that they had?
Yeah, super critical. And just to answer Michael's question, how vital managers and supervisors are to model these behaviors, I think very, very critical, right? I mean, starting there, they're the ones that are, with the charge nurse running the huddles. And so, it's really important to role model, how we want the staff to also understand why this is important. And so really, really important. I'll say, and I think you hit on it, Malie, the importance here is engaging frontline staff in improvement work, right? Showing them data, making sure they're involved, all of the things that we're putting in place depend on our staff. And so I think, the other really important part of the huddle that isn't shown here is, or maybe it is, I'm sorry, maybe it's just too small, is really, what's your idea? What ideas do you bring? When it's one thing I think historically at Laguna was very top down, like you have to do this, you have to do it this way. But I think engaging frontline staff in those discussions about, hey, wait a second, you're doing the work every day. What are some ideas you have that perhaps we haven't thought about? And so I think it was a really, really important and continues today critical way to have those really important conversations with the frontline staff. And this, the huddle really is the forum for that, which is great. I don't know, Baljeet, if there's anything you want to add, but those were my takeaways.
Yeah, no, no surprise to all attendees, Troy nailed it, and Malie as well. I would say stepping back for the story, this work is hard, and it only became harder trying to bring our organization along because that's the only way we should be doing it. We could be doing it, right? But anyone who's been in a role of a mentor with a mentee or really coaching and teaching, it does take some significant effort to fight the urge to say, I'll just do it myself or whatever, and actually learn and teach. And that's hard. So it's major kudos to folks who, like the team here at Moss Adams, that does a lot of work and makes that their career. But the only way the organization was going to change was if we all go together. Not if I said I was going to do something or if Troy was going to do something. And so the great ideas and engaging folks at the front line is great. But at the same time, we know that you can take the 100th best idea and execute it 50% of the time, and you can change the world. And so the part of the idea is that once we have the ideas and engagement, what do we do and how do we put it all together? And these boards and this ability to engage are able to tell that story together and build on the successive interventions and successive efforts that were put into place. Other than that, it's not just, you get to do one of 5 things today. No, we have to do all 5 things every day for every resident every time. And I think that this engagement helped us partner and to hear the challenges of why it's hard to do all 5 at the same time. And sometimes you're like, well, wait, great, you're right. We didn't anticipate that. I mean, if everyone has their morning routine when they get up and go to work, you get up, you grab your bag, your laptop, maybe your public transportation card, your car keys, preceded by getting dressed, brushing your teeth, etc. That's normal. It's now what we do. But if you told me one day that, hey, you have to do all these things for the first time, you got to brush your teeth, you got to eat breakfast, you got to grab your car keys, you got to walk to the train station, whatever it might be, it's overwhelming, right? So this helped us make it less overwhelming without sacrificing the steps we know we needed to take.
Awesome. Thanks to you both for that perspective.
I just want to say that Baljeet nailed that. Great job, Baljeet.
Thank you.
Well done. So now you can see that the whole system kind of establishes this, what we would call linked goal setting, linked problem solving across all the levels of the organization. So this does a couple things. This enables the leaders to focus on the barriers that are maybe a little bit more complex, because it's empowering frontline to really be the problem solvers and function as the work experts they really are. Ultimately, this establishes bi-directional lines of communication. So as Troy and Baljeet both mentioned, it's about deploying or cascading the targets from the leadership in a clear pathway of communication, but it's also about escalating the challenges from the front line to the appropriate level of leadership. So with creating clear lines of communication there, all built on the cultural foundation that recognizes the frontline experts as the work experts, and engages them and asks them for ideas on how to improve that work. Okay, so one last piece in the puzzle. So often the deficiencies that were identified couldn't just be addressed by one department because they cross disciplines. So in those cases, we needed to bring a cross-disciplinary team together to break down some silos and to come up with countermeasures and highly reliable processes that could withstand the fact that they needed to cross disciplines and departments. So here's one example of that around equipment storage on the nursing units. which really is more complex than you might think. What we learned is we need to balance staff having the equipment they need, when and where they need it, ready to use, in good operating order, which makes sense. But balancing that with a safe environment for residents and staff, balancing that with a home-like environment for residents and families, given this is a skilled nursing facility environment, and balancing that with regulatory compliance around requirements for where and how equipment can be stored. So in this example, we brought together a team members from nursing, EVS, facilities, engineering, bioengineering, quality, infection control, regulatory, to name just a few, and brought them together to establish those standards for what equipment could be stored where, and establish those processes for equipment cleaning and maintenance and tracking and managing equipment that might be shared between units. And to set up what training needed to happen and for who, and also to follow up with regular observations of what's working, what's not working, and how to continue to improve. So what you see here are some before and after pictures showing the impact the team had. In a moment, Troy's going to share more quantitatively the results of this and some of the other work, just as some other examples. But this is just one example of how those type of cross-discipline challenges were addressed. Okay, so thank you for letting me walk through some of those examples. With that, we're on to our next polling question, number 5. So from the framework that we described, which aspect resonated most for you and your organization? So was it organizational change management? B, leadership accountability structures, C, frontline problem solving, D, linked and aligned visual management, or E, cross-disciplinary improvements? It's just curious which resonated, which may mean these are things that you're already doing, may mean these are things you're interested in learning more about based on what you know about your organization. So we're at about 65%. Great. All right, about 77% of folks answered. That's awesome. Okay. So let's see across the board. We've got a fairly, the first 3 seem to resonate most: organizational change management, leadership accountability structures, and frontline problem solving. Less so the linked and aligned visual management and the cross-disciplinary improvements. So that's interesting. I'd love to hear more about that as we get into our Q&A portion in a few minutes. Thank you for answering that question. So to wrap up our presentation today, I'm going to hand it off to Troy to discuss the direct results and outcomes from the tremendous recertification efforts of Laguna Honda and the benefits of using the chosen approach. Troy.
Thank you, Malie. Just thank you again to you and Ryan and the rest of your team for your dedication to Laguna Honda and its residents. You were true partners throughout this journey, and we just wouldn't be here without your team's assistance and leadership throughout this process. So again, just thank you so much. I get the fun part of the presentation, get to walk you through some of the outcomes of recertification journey and how much change we were able to drive in the midst of crisis. Next slide. So I'm guessing a lot of you in the audience today have been through a survey process, right? Either by the Joint Commission, your state agency, CMS. So I'm just going to guess that that's the case. Well, as a part of the settlement agreement that we talked about before, we had, imagine this, 3 full soup to nut surveys and additional smaller scale surveys over the course of a single year. And when I say full survey, there was a day where Baljeet and I were in administration and there were 22 surveyors that were getting signed in. right? These are major surveys to see the progress and to make sure that we're in compliance with regulations. And so, in addition to that, to those surveys, CMS had assigned permanent CMS monitors to be here daily, and they were also reporting to CMS on any deficiencies they noted, which then required immediate resolution. So they were stationed here and would do rounding throughout the day and on weekends. And as issues or challenges arose, Baljeet and I would get a call. Hey, come down to our office. We need to discuss an issue with you that we just found. And so, those were, some very interesting days with the monitors. We had to balance. So with all of that, when you think about the surveys, the CMS monitors, we really had to balance the messaging between leadership and frontline staff to mitigate excessive anxiety about the surveys, about the CMS monitors presence. And so this is very anxiety provoking for folks. I mean, people do get anxious when surveyors are around. And when you have CMS monitors here every day, it's almost like having a survey every day, right? Because you don't know if they're coming to your unit. And so it was really important for us to message, look, they're here to help us. The monitors that we worked with were very collaborative with us, and really also, as Baljeet said earlier, with CMS and CDPH wanting to see a positive outcome, they did too. And so it was really important messaging to have with staff that this really affects on a daily basis. So all of these, you can see the number of cited tags, deficiencies throughout all of these different surveys. And these all resulted in action plans to resolve any cited deficiencies, eventually totaling more than 1,000 milestones. And a milestone is an action plan. It addresses a finding. It has an executive owner. It has a team that's assigned to it. There's data assigned to it, and there's accountability assigned to it. And there were 1,000 milestones throughout the course of the settlement agreement as we were moving towards recertification. So just think about plans of corrections that you've done in your own organizations, 1,000 in a year. And so it was really very stress-filled, but important that we were identifying these important gaps to get us recertified. So with the findings and with the milestones, they really varied in size and complexity. The majority of these milestones corresponded directly to highly complex and independent improvements requiring evidence of completion by specific deadlines. And we talked about this, right? So before it was like, okay, well, team, you go, fix this. Well, those days are over. We now have an improvement structure. And all of the things that we talked about before, we actually need you to come and report out and let us know how things are progressing, but more importantly, what are the challenges and barriers that you're coming up against that leadership can assist you with? Really, really important piece. So the sheer volume and the magnitude of the improvement work this represented in a year's time is almost incomprehensible, and is really a testament to our Laguna Honda staff, our partners, and their ability to swiftly implement an incredible amount of required change and improvements. And we talked about this before, that we wouldn't be here without the staff at Laguna Honda, right? Whatever we're implementing, whatever we're putting forth, it's the staff that's actually doing that work. And so so important that they were engaged throughout. I do think a big part was the embedding of Moss Adams' team to rapidly deploy and implement its strategy acceleration system to help us navigate the crisis and drive organizational change, which was described earlier. And again, just can't say enough to the Moss Adams team for helping, getting us to where we are today. So remember, these improvements had to stick. This was not just improve, turn your head. These needed to stick. These were system level improvements that we needed to sustain in order to improve the quality of care that was being provided at Laguna Honda. And that's what this journey has been all about. It's not about patchwork, fix it, get recertified, but how can we actually make Laguna Honda the best hospital, the best skilled nursing facility, a high reliability organization that, that will carry on far beyond recertification. So a few examples of our sustained improvement in regulatory compliance you can see here. If you look in under regulatory compliance up. So to achieve 100% for Laguna Honda here, we have hired rounders. These are now part of the improvement fabric of Laguna Honda. We have people that are rounding the units 7 days a week on all shifts. And the observation on the nursing units by these licensed rounders, you have to, again, be greater than 90% compliant for every unit in all three categories of environment of care. So they're looking for things like, home-like environment, clutter, fire extinguisher checks, those kinds of things. Infection prevention, are people wearing their masks correctly? Are people handling linen correctly? And of course, hand hygiene. And we get these, really objective observations from these rounders, and you can see the really big improvements that we made in that area. If you look at deficiencies down, these are our severe findings. And severe findings we define as an individual finding by one of our licensed rounders that could jeopardize certification. So this is a finding that's like a stop the line. I've seen it. If a surveyor saw that, we wouldn't get recertified. And so 0 defects was the only acceptable goal. And you could see, we had quite a few severe findings, in the past. And as we, really put these system level improvements in place, you could see that those severe findings were decreasing over time, which was really important for us. And then finally, the sustained cross-disciplinary process. This was an example of equipment storage, and Malie had talked about this a little bit earlier, where we saw sustained decrease in fines related to equipment storage after a dedicated improvement project team, really created standards for every unit. I wish we could have shown some pictures of like what it looked like before, but you would go into a storage room, for example, or you'd go down the hallway and it was chaos. There was no rhyme or reason of where a blood pressure machine was, or a treatment cart, or a linen cart, right? And so this was really important and required a lot of disciplines to help us to get to where we needed to be, including nursing, EBS, facilities, bioengineering. And you can see now when we're on the units, the rounders on the units, it's really not an issue for us anymore. And so, again, a really great example of a multidisciplinary improvement. And it seems like a small thing, but it's not, right? We had significant in our survey, like egress findings, like, the regulations are very clear. You have to have a certain number of feet in a hallway for fire life safety reasons. And it was a big, it was a big issue for us. And so it was great to see this improvement. Next slide. So to put in perspective how much Laguna Honda changed in a single year, this is a really, really important slide. Compare the first monitoring survey. Remember, we talked about the settlement agreement, and the first monitoring survey was in November of 2022. We had a lot of findings. To the November 2023 certification survey, within that single year, there was a triple-digit 100% reduction in the number of substandard care tags cited, including 2 immediate jeopardy citations and a 59% reduction in total tags cited. And for those of you that aren't familiar with, how the findings in a skilled nursing facility, it's based on scope and severity. So, anything above an H level finding to an L level finding is substandard care. Those are like stop the line moments. We've got to get that fixed now. We had 100% reduction in those, which is, really, really amazing compared to where we were at the beginning. So overall, this corresponds to an 85% reduction in the aggregate score. And the aggregate score was a metric that we developed based on the scope and severity, was a number that was provided. The higher the scope and severity, In other words, the more serious the finding, the higher the number. And so the aggregate risk score was something that we followed throughout the process to make sure we were keeping the momentum and seeing the drastic decrease in those high-level, all findings, but in particular those high-level findings, which would put us in jeopardy of not being recertified. So despite the overall, the ever-changing operational landscape, the need for deep culture change and the urgency of each and every milestone, we were able to drive the extraordinary amount of change that Laguna Honda required, as you can see here. It was a huge effort in which leaders and staff at Laguna Honda, really demonstrated remarkable fortitude by always prioritizing the well-being and needs of the residents. And that was something that was so evident as we went through this process. As we said, Laguna Honda was super important to this city, to the residents that are here, to everyone. And I think, everyone, really had that same goal in mind in making sure that we could become that hospital that folks depended on us to be. And you can see here, from just from the results, how we were able to be successful. Next slide. And with that vast amount of organizational change came recertification. Really a lot to celebrate. We were recertified in the Medicaid program in August 16th of 2023, so just about a year ago. And so this was really important because with 95% of funding for the residents that we have here at Laguna Honda with Medi-Cal recertification and closure avoided, the home of hundreds of residents were saved. So just with Medicaid recertification alone, this was a huge celebration because we knew we were now going to be here for the residents. Very, very important. And all of San Francisco was ecstatic that the bedrock of the healthcare safety net would continue operating for decades and centuries to come. And you can see here the mayor with our director of health and CEO of the network right there in front, with a press conference and really announcing this really, really huge announcement when that happened in August. And it was a great day. Next slide. And then really solidifying Laguna Honda's long-term future even more because the Medicare certification also just as critical. We were recertified in both Medi-Cal and Medicare in June of 2024. And so furthermore, as of August 2nd, Laguna Honda resumed admissions, welcoming more residents that will call Laguna Honda home. So all of this work that we've done has really paid off in a big way. Now the focus, and I think this is really important, is really sustaining the gains for the largest skilled nursing facility in the country, but also one of its best. And, we still have a lot of work to do. I don't want anyone to think that, yes, we're celebrating, we're recertified, but the key now is sustaining everything that we've done so that we never find ourselves in this place again. With that, I want to share again just my gratitude for all of the staff at Laguna Honda. This was a huge undertaking for everybody here that made recertification journey possible, and also to thank the community and all of our partners for their support, and a special thank you to Ryan and Malie and Moss Adams and their team. Again, wouldn't be here without you today. So I believe now I'll hand it back over to Malie to bring us home.
Excellent. Thank you so much. Very quickly, want to kind of extend that thank you to the full Moss Adams team and share with the group that has joined us today. Just, it truly takes a village. So thank you to the full team. And we have been so fortunate to be able to support Laguna Honda and other organizations in being able to address these strategic challenges, emergencies or not. So I think with a minute to go. We'll get to our last polling question. To what challenge will you apply these methods within your organization? A, strategy execution, B, operational turnaround, C, regulatory compliance, D, staff experience and retention, E, cost reduction, and F, all of the above. Let's go ahead and get that last polling question in under the wire.
And while everyone's doing that, I also want to thank Baljeet and Troy so much for joining us on this webcast. Very much appreciate not only your willingness, but sharing your perspective and being so open about the journey that Laguna Honda took to recertification. And I know no question, Laguna Honda would not be in the place it would be without you two.
Absolutely. Absolutely. All right. Thank you all so much for answering that question. So a good portion of all of the above, not quite half of the team. So yes. So I just want to say before I hand it over to Amy to close us out that we're sorry we didn't get to Q&A here, but we will be answering the questions that you put in the Q&A. We will follow up with you on those. I think you still have an opportunity to add a couple if you haven't done that yet. And with that, I'm going to hand it back over to Amy to close us out.
All right. Well, thank you all for a really great discussion today. I do wish we had more time. But as Molly mentioned, feel free to reach out if you have additional questions. Their contact information is in your console as well as in the slide deck, which you can download now from the handouts window. And then if you met all CPE requirements, your certificate is available to download now in the CPE progress window. A copy will be emailed within 2 weeks as well. And then the image in the upper right-hand corner of your console will take you to more information on our Executive Healthcare Conference, which is coming up in November in Las Vegas. So hopefully you can join us for that. And then finally, here's a link to a survey for today's presentation. Your feedback is always appreciated. And again, thank you for joining us and take care, everyone.
Thank you, everyone.
Thanks, everyone.
Thanks, gang.
Take care, everyone.
Bye.